All right, so Mark was talking about this a little earlier. Maybe you have a neck that isn't the neck you've always wanted. Well, apparently the big 4-0 is the time when you start to see a little sagging and maybe a little dimpling. But you know what? You don't have to worry about that anymore because there are little neck tune-ups that you can have in 30 minutes, minimal surgery, and you look fabulous. So this morning we're talking to Dr. Scott Miller, a plastic surgeon, and his patient Olivia. Welcome to Fox in the Morning. This has been the hot topic this morning because Mark insists that he needs one of these mini tune-ups.
Mark's good to go for a while.
You see, Mark? Yeah. You're good to go.
Okay. Mark's getting a complex, but he's okay.
Because apparently he's looking at 40 way in the rear view mirror, so...
He's making 40 look good.
See, that's what I'm saying. All right, so... First of all, we want to talk about plastic surgery in general because plastic surgery has come a long way where many procedures are less invasive these days, and the neck surgery being one of them.
Absolutely. I mean, I think there's more and more we can do through less and less, particularly with regard to incisions, access, and then subsequent healing time.
Okay, so when you're talking about getting a mini tune-up for your neck, what are we talking about? Like, what are some of the problems that people are seeing? I've seen people that have maybe a little bit of a waddle, that sort of thing.
Exactly. I mean, it can involve, basically what we do is we do a neck check, and we look at what I consider really the 3 signs of a beautiful neck, and that can include basically the neck angle, or that old right angle that everyone's seeking, the angle of the jaw, which I think if we, you can see it's right in this corner right here. That corner is a subtle but really significant indicator of sort of youth and strength and vitality by having that angle of the jawline. You're looking good.
Okay.
And then a nice smooth jawline that's not interrupted by a jowl or any fullness there. So those 3 things really, in men it makes them look stronger, and women it makes them look more elegant, and a guy it makes it look like he's on the board versus cleaning up after hours, and in women it makes them look like they're ready for the party and not going to stay home that night. So it has a subtle but significant effect.
So taking care of the neck can sort of shave years off of your
exactly
life?
Exactly.
Okay, so that
years and stress.
Yeah. So let's look at some before and after pictures because we have some pictures of Olivia, and I hope, let me see if that's the one that comes up first or we can adjust. Yes.
No, there you go.
All right, so there's a before and after, and I have to tell you, Olivia, you're a very young woman, and I was a little surprised to see that you wanted this, but explain what it is that you were looking for.
I just wanted a more definition in my jawline. As you could see in the before pictures, I was very round. It made my face look very round and full.
Okay, so Dr. Miller, then what did you do? You made a little incision under her chin. Is that what you did?
Exactly, a little, 2 millimeter or 1/8 of an inch little incision, and that allows us to do everything we need to do. Now, in some cases, you have to do that neck check, and you have to look at what needs to be done. In some cases, somebody just needs a little aspiration, as is in the case of Olivia, and we're able to...
You just what? You sucked out a little fat from there?
We sucked out a little fat, not only just from right under the chin, though, which is important, but also towards the sides, following along the angle of the jaw. So you really define not only the neck, but the jawline and the angle of the jaw.
Now, we should mention, as you said earlier, that because with Olivia, I mean, she is not an overweight woman. She just happened to have a fullness in the neck. It has nothing to do with being overweight or that sort of thing.
Exactly. Our bodies have, that first, extra gram of fat that we put on when we were maybe 14 or 16, and it kind of stuck with us because that's your body's little storage depot, and it's not going to go, and it's just genetic who puts it where. And in her case, it was there, and she was fit and trim and doing everything she could to put her best foot forward, and she just wanted to take that extra step.
Okay, let's look at, we have another one, I believe. This is a more dramatic look at a before and after picture here, right?
Yeah, and this is actually the same procedure, just applied to somebody maybe who needs it a little bit more. Yeah. And so, but the same general concepts, little poke under the chin. She had an old burn scar there, and so we were able to basically release and then aspirate and create that contour, that subtle shadow along the jawline that creates the look of youth and fitness.
And is there a last one? Because I thought this one was the most dramatic of all. I mean, look at that.
Exactly. Now, the next step, which is the one in between there, which is where we just do a little bit of tightening in front, and then this one where we did not only a little tightening, but a little bit of redraping as well for some of that skin laxity that had lost its elasticity. So it's sort of a ladder of neck rejuvenation that you can follow according to who needs what and how to get the best result. But everybody can end up at the same point with a really, really pretty neck.
So no cutting or any such things, right? Just
Oh, it's, you know,
Oh, okay.
you got to get in there somehow, but not a whole lot.
Not a
Exactly.
whole lot,
The
okay.
difference is whether you're going to have, you know, a 2 millimeter or a 4 millimeter, which equates to about an eighth of an inch or a quarter of an inch sort of scar. So yeah, you don't have to do the big scars on the side and that sort of thing if you want to avoid that, and
Okay.
if you don't have, you know, those problems.
All right, and Dr. Miller's information is right there on your screen for the mini neck tune-up. And we appreciate both of you coming in this morning. Thank you.
Oh, it's our
Thank
pleasure.
you.
Great to be here.